Good afternoon, everyone. Welcome to CRPN Central, the podcast number 8 in the industry, by the way, according to FeedSpot, that brings you some of the best minds in clinical research so we can talk about our challenges, explore them, and get something done to make positive and productive change in this industry. Like, comment, subscribe. It helps a lot. I can't tell you how much it means. And let's bring on our co-host, Mr. Mitchell Hilby. Love in the background. My fellow Diversa bro. How you doing, my friend?
Doing well. I'm excited to hit at least number 7 on Popularity Podcast after these amazing guests today.
Of course, you know what number 7 was.
I don't remember. It doesn't matter. We're gonna be just moving out, man.
It was Jimmy, SCRS Talks. Jimmy
sorry,
Beckel.
Jim.
So sorry, Jimmy. We're on our way. So please support CRPN Central. Like, comment, subscribe on YouTube. We're only going to be getting better, and let us know what you need, and we're here to serve. Mitch, first and foremost, I want to make this very, very clear. It's been on my mind all day. I am observing Juneteenth right now. Happy. I don't know if I'd call it happy, but I do observe Emancipation Day, Freedom Day, whatever you might call it. Importantly for me, I always look back to how emancipation happened in the first place. And it took a lot of strength and a lot of sacrifice from a lot of people. An entire nation, an entire community had to come together to get something like this done. We all knew that it was wrong. We all knew that something had to change and this was inappropriate. And it took a lot of sacrifice and a lot of fighting to get it done. But it is very well worth celebrating. I'm so glad that we are making this as an observation. What are your thoughts?
Yeah, I mean, without getting too much into it, because it's not the focus of this podcast, we'd probably dive into it a lot more on the Diverse Trials podcast. But you know, the weeks, months, years, decades following have been a continued struggle. I've made some posts and comments throughout the day that there's a lot of intentionality needed, and observance, and the support needs to be consistent. Mm-hmm. It's a never-ending battle. It's a never-ending struggle, and I think, unfortunately, it's gonna continue to be that way. But we're here.
Tell you what. If you want the Diversa Trials team to have a follow-up discussion on this, like, comment, subscribe, send a comment to Mitch or me or Hadi or any of the Diversa team, and let's see if we can get someone to talk about that. But I do not want to take the spotlight away from some amazing professionals that did some amazing interviews for some awesome chemistry in a CRPN episode. Irena Davies plus Christine Senn equals complete feasibility. Mind blown. I loved it. So, Irena, let's start with you. Would you be willing to introduce yourself to the audience?
Yes. Hi, everyone. Such an honor and privilege to be here today. My name is Irena Davies. I am currently at the Minneapolis Heart Institute Foundation as a clinical research manager. I've been in the clinical research space now for over 18 years and been on the site side. So just honored to be here. Been completing the feasibility questionnaires since day one. And back in the early 2000s. So things have shifted quite a bit.
I can only imagine. And Irena, I had the opportunity to meet you in Minneapolis, see what you've done up there. Wonderful work. Thank you so much for what you do for your community. In all sincerity, you've done a great job up there.
Thank you.
Christine Senn, do I need to introduce you?
You totally do, but I'll do it. I loved meeting Irena. I'm totally with you. We met a few years ago at ACRP, and she's just so fantastic. And congratulations on your podcast ranking. That's really impressive. I'm Christine Senn. I am the Senior Vice President of Site Sponsor Innovation. That was a mouthful for a moment there. Sorry about that. But trying to bring sites and sponsors, CROs, tech vendors, everyone together to be able to, like you said in the intro, make this all work better, an easier industry to be successful in.
Yeah. And so, Christine, again, I'm a huge fan. I think I saw you first. I think Brad Hightower was interviewing at one time, and I'm like, oh my gosh. And then I got to know you and see what you've done and listen to your voice. And I'm so excited to have this episode.
Thank you. And yes, Mitch, we will coordinate outfits next time.
You'll get there. It's fine. Irena and I just
good.
Yes.
totally didn't plan it though.
Wonderful. So today's episode is a follow-up of a verbal or an audio-only interview that I had with both Irena and Christine. We asked them questions about feasibilities in particular. We compared their answers, and we found some very interesting similarities and some interesting differences between the answers of Irena and Christine. I think together we have a very nice and comprehensive idea of our current understanding of feasibilities in the industry. And on top of that, maybe where we could take feasibilities or how we could improve feasibilities. So I'm going to turn it over to, I think, Mitch first, because Mitch, we didn't get to have our token conversation first. But when you listen to the comparative interview between Irena and Christine, what were your initial reactions and thoughts?
Yeah, I mean, I think it's pretty obvious, and probably most industry professionals share the same passionate and long-term goal, right? Everybody wants to see feasibilities improved and the process be better. So that's shared amongst everybody. There were a little bit of some differences, which I love, regarding like this paper versus electronic aspect too, and in which ones you feel a little bit more strongly towards. And maybe that's part of, some of the ways that we've seen innovation that have almost kind of limited that flexibility when it comes to feasibilities. But I mean, I absolutely loved it. I love both of them. Christine got a lot into talking about some of the conferences and referencing some of the conferences you've been at and some of the speakers. And when you brought up, relationships and how, one, I'm jealous that you're taking Fox on a date, but when you brought up the relationship with, partners and children, at Magi East this year alone, I gave an entire presentation on relationships in business and how, you should kind of run your business and build a team like a relationship. I always talk and make analogies to like 90 Day Fiance and Love is Blind. And immediately what I was hit with as far as feasibilities, in my analogy I'm going to leave with today, is that feasibilities to me are kind of like the online dating platform in the research industry. Like that's where we're at. It's that exploratory, like here's some information about me, but it's like also not functional at all. And most people tend to hate it. And then Irene, you also, you dropped, your Barbie dream world of feasibility. And again, at Magi, I was also on the whole Barbie dream world, panel. So it was great. And I love both you guys. It was phenomenal.
I can just see a clinical trials Tinder sponsors swiping right or left.
Just swipe left or right on feasibilities.
Left or right. There you go. Let's just get to a clinical feasibility Tinder.
Hasn't already someone put out something about being ghosted in the feasibility process? So the whole analogy really does work.
Oh yeah, it's so, have you heard from any word? And it's
what did I do wrong? I don't know.
I don't know.
Just red flags and.
I never even got a baby I change offer. It was just, that's it, So it's just so many analogies to dating or to relationships or to job applications, job interviews. I know that we talked about that. Any level of one person seeking services or products from another person, you could make analogies all day. And I agree. I think that the best part about this was I know that Irena and Christine know each other through the industry, and you've met each other and you've talked, but the resonance of, not only have you both been in the industry for 18 years, which I love that analogy. It's like, that's a comparative analysis, a dream for a scientist, because that's one less variable. You have the same and equal parts of time in the industry, but given the extent of your experiences and what you've done all the way from paper onward, your dedication to progression and innovation, I think it was a very, very good analogy to understand maybe some of the principles that we can really focus on in the feasibility world so that we can make it better and do things better. Christine, you said that on paper, when you do paper feasibilities, you have the opportunity to write notes on the side, and you get to a little more flexibility and understanding and learning and kind of absorbing the protocol. So you have a really good and educated business decision in the ability to even accept the trial. And I think, Irena, you were going down the same path with paper, but as I was listening to the interview, I didn't get a description of why you like to kill trees.
Why I like to kill trees. I think it really came down to when I was killing trees, more trees than I am now. It was, the questions were a little more simple, right? The questionnaire feasibility was not multiple questions. It was a 5-page questions. It was more simple. You could add comments. You could go back and review it with your investigators and make changes as needed before you actually submit it, right? And so with electronic, with the portals, we don't have, sometimes we can't go back to, change your answers, or there's not a way you can save your responses so that you can reference it later. Versus paper, I can easily reference it. I can reference it for the next time I fill out another feasibility questionnaire for a similar trial. Then, and then I can generate the numbers instead of going back and trying to figure out, do I have the patient population and what's the right number to put down.
And so, Christine, and I'll have a follow-up for both of you on this, but Christine, when you had talked about that, you said, hand cramp, that's, crazy. But when it comes to the strength of paper versus electronic systems, and we all know efficiency, electronic wins, but flexibility of paper, do you see a world where we can get a little bit of both? Like we can get an electronic system with the convenience of paper?
Yeah, I do. I mean, I would not want to see us continue or go on paper at all. What I really would envision would be that there would be quality databases, that something would hold this data. And of course, each time you have the opportunity to change it. But, as an example, it is very hard for sponsors and CROs to know who to contact. I know that you've commented before, please don't contact the principal investigator. There's a whole central business office in most cases. This is completely true, but who else would they contact? I mean, for the most part, until you get to know a company. So it would be nice if it was like BD or feasibility at blank site network or site company or whatever, to make it really easy. And then the onus is on that site to keep up their email distribution list. That would be the ideal, I think, for anyone. So if all of that was loaded in, like who do we the feasibility questionnaire says, who do we contact for contracts at, like, you never have to update these things. So think about the way to have the most seamless process. And I think then a database makes sense. It wouldn't make so much sense if it was every single time changing it from Lisa Smith to Ben Kozlowski, like every single time you're doing it to have to update it. So that wouldn't make sense. But yeah, I think that paper should totally be gone, because it's not really then possible. Now you're talking about data entry on someone else's end, right? They have to put it in basically an EDC of their own type to capture this. And there's really nothing that they can capture in a way that they can analyze it. So yeah, I think we would have a database. I think that the site should be able to update it. And then I was part of a consortium that was talking about feasibility, and someone threw out there, feasibility should be two questions. It should be 2 questions for a trial. Now, I heard on a different feasibility webinar recently, they're like, well, each question is like first name, last name. That's already 2 questions. Of course, that's not what, the person meant. You have all the basics that are already loaded in. And then the question might be, these are the inclusion criteria. Do you think how many patients do you think you could find? Now here are the exclusion, how many, or whatever. This is the not facility. This is the equipment that you need. Do you have all of this? That's a yes or no question. You don't have to go through each one. It should be in the database, and can you get it? So I think there's a huge opportunity to make this super simple. And I think actually it's easy. I think computer programming. I don't think that's not AI. That is programming.
No. And that's the thing is literally not novel. There are other industries that we can model that have mastered this. This is not hard to figure out. It does, however, put forth some challenges given the business models that we have in this industry. Every single trial is so siloed in its own little compartmentalized project. It's not holistic across the entire system. So we have to everything is start from scratch, duplicate. We're not allowed to pull from other things because everything is its own contractual little thing. And for that reason, I remember, Irena, you had a really cool idea where you're like, you know what? Let's just make a Minneapolis package. And we're like, here, this is us. InvestigatorDatabase.org tried that. All these other groups tried that. The Simply Amazing Talk Down Tech have tried that. It doesn't happen. If you have, and I realize it's kind of like an analogy to sports. Everyone talks about home field advantage, right? That's the big thing. Well, we got home field advantage. We know the crowd, they're going to be there. We know the stadium. We know every pothole in the field. We know the whatever. That's home field advantage because you are working in an area that you are familiar with, that you can be more efficient in. And so as a result, I think there's this giant tug of war on home field advantage. Who is going to do the data entry for each other in this siloed contract industry? And unfortunately, the way that it is right now, it's the site. So the sponsor and the CRO always insist on their own home field advantage when it comes to data entry, specifically in feasibilities. So, I mean, Irena, and I'm not saying verbatim, but when you put together this package for sponsors and CROs, you kind of mentioned it on the podcast, but what was the immediate response?
I get a 50-50 response. I mean, sometimes it's great. They take that and, no questions. Though, and I guess it really depends on who's receiving it, whether it's a larger CRO or sponsor or maybe middle size. And I feel like I've been able to get the mid-sized organization to really like the package and just take it and put it into their system. But the larger CROs and sponsors have a more difficult time just because they are entering that data about my site capability and experience into their own, like Christine said, EDC system, right? So that they can compare all sites across to make the right decision. So, it's 50-50. I've gotten some positive and negative responses, and I get it. But I'm trying to just find solutions to, really eliminate the repetitiveness of answering these feasibility questionnaires about my site and what, how many years of experience do we have, and what is our patient population, and what equipment and do we have? It's the same questions over and over. And so instead of answering 10 feasibility questionnaire a month with the same answers, here's just my package, and you guys can do what you want with this information. And then if you like what you see, come and visit me, come see me, come on site, let's go on a date and let's explore. Are we a good fit? And you can come check out my my team and my site. So
yeah. I love that. I mean, and that's kind of where that 2-question feasibility comes into play, because you have all that core that really doesn't change very often, or you make regular updates just like you would a CV or anything, regulatory wise. But it's those real nitty-gritty specifics that you might need to know for a study. And honestly, even when it comes to equipment, from that like sponsor perspective, I don't feel like that's ever been a deal breaker. You just, as a sponsor, you work it out and you help get the equipment, you source things for sites. It's not a big deal. So sometimes even some of those questions, it seems almost unnecessary, because in the grand scheme of forecasting is what feasibility is generally about, is we want to know how many patients we're going to be able to get from these sites. That's like the core purpose. Are they going to be a good fit? Are we going to be able to get quality patients from the sites? And that should be the majority of the focus.
Can I?
Mhm.
Okay, Dr. Fox, you remember I derailed us like 17 times. Okay, I have.
It took a lot of editing, but it was worth it.
Well, you can't edit this one, so sorry. My halo light keeps going off, so I'm like light, I'm dark. So we were talking, or you were talking, you and Mitch were talking earlier. We are celebrating a day that that is about so much more than diversity and inclusion. It is about many things, but among them is diversity and inclusion. And I'm thinking about like this idea of a package, and I just think there's so much that is not. If the word isn't unfair, I don't know what the word is, but there's all these things that if we're trying to get new sites to be included and new patients, we shouldn't have to have it. There needs to be another way for feasibility to happen where you don't have to have a packet. You don't have to know the trick. And I would like to talk about this, by the way, but of doubling numbers for your patient enrollment projections. I don't think a new site should ever have to think about that or play that game. And I don't think any of us should have to play that game. We could, again, chat about that. But I would love to see as we talk about solutions for feasibility, include inclusion of more sites. And that's what these what I think the tips don't enable us to do, unfortunately.
And now we're going to the naive sites versus the inclusion of people who want to be part of research, the research deserts, and we're running into that right now. I talked to so many people. I'm sorry I lose track, but they were talking about how one of the biggest challenges of trying to recruit new and diverse sites is that they are so new that there's no way on an experience level they can possibly compete with the veterans of the industry, which it sets them up for failure the whole time. So you asked, Christine, what should be the proportion of naive or new experienced sites in a trial? Should that be, I mean, we're talking about diversity in patient participant populations, but really let's talk about diversity of a PI. Let's talk about the diversity of all of these different sites that we have to select, because if you have a diverse PI, you're going to lead to diverse patient populations. Do you see, I mean, could that be part of the feasibility portfolio for studies? We have to have these different kinds of sites if we want diverse patient populations.
It certainly could. I think that would be a level of complexity right now we wouldn't know, because there are certainly investigators who are, I don't know if I want to call them diverse, but they're not what we've seen the majority of so far. And they don't necessarily get a different patient population because that's not the way the recruitment's working out, or the advertising, or some other reason. And I also remember, boy, this is a long time ago, but Irena, this was a cardiology trial. It was my first one. And it was 16,000 patients worldwide. It was a phase 3B. It's the one that got, oh, I shouldn't say the name, but it came to market many years ago. And the way that they got diversity was by going to different countries. So, I mean, it's also not just diversity with like new PIs, new sites. It's also where we are across the world. Like there's so many variations of that. I think that would be a little bit hard to put in a bucket. It would depend on your trial. I think they'd have to start pretty early. But if you're talking about just like naive sites, I'm ballparking here, but for like a phase 2, I would want to see probably 20%, because you have to make sure you have the confidence to get to a phase 3. Like it's costing millions of dollars for the sponsor companies. They also have to have tried and true people and all that.
Yeah, and time. One of the millions of dollars is weeks and weeks of time.
Yeah.
Irena, would you like? So we have a question. Hi, Dan. We'll get to you here in a minute. Irena, would you like to respond to that?
Yeah, I mean, I agree with Christine. I mean, what I'm seeing is sponsors, instead of getting those naive sites, or looking to see how they can support naive sites, investigators, research naive, they're going to other countries or other areas in the country that has that patient population. But we have diversity all over the country, everywhere, and instead of going to where they know those patient population, we're missing out on opportunities to offer to all all patients to be able to participate, because we are being very selective on what areas we are looking to conduct these trials, and to be able to get that patient population, that diverse patient population. So yes, 20%, we need to do better. How do we do that? How do we reach out to certain communities, right? And talk more and educate more on clinical research so that more patients are aware of, all the work that we're doing here. And not, and going out to talk to these communities and educating them on clinical research, but not really expecting much back, right? Not expecting them to enroll in our trials, because we want to build that relationship and trust, and that's going to take time. And sites can't do it alone. It costs money, time, and we do need support from our sponsors and CROs to help us to continue to do this important work so that we are able to have a more diverse patient population in these clinical trials.
Yeah, we talk a lot about unconditional community engagement here. That's how I refer to it as. Other people say continuous community engagement, but being there unconditional to me is a little bit more than continuous. It's not just engaging. It's engaging without that expectation of needing to have something back, because that makes it transactional. But I don't think, I was going to say just real quick too, is like, I don't think education is always important. It's always the top priority when we're engaging communities, but there's a lot of talk about, mistrust in healthcare. And I don't even think that that's really a big issue. The majority of the time, the issue when you engage communities and talk to them is nobody's talked to them before. If you're not presented, you're not asked, you're not aware of those opportunities, you're not going to participate. I think people default a lot of times to, there's a mistrust in these communities, and these are some of the challenges. And maybe you just also ask and try, put in the effort, right, to engage in those communities as well. But the challenge there lies with the sponsors and CROs that have to make those decisions on what sites to use. It's really, really easy to default to, this person has many more years of experience in industry and research. They've got a lot of trials under their belt, so we're going to go with that PI. And that's great. I get that. But it doesn't
risk aversion, isn't it? It's all risk aversion.
Ultimately, it doesn't always pan out, but it's tough. You got to be able to build those relationships, though, and it's really challenging to build those relationships as new sites, as naive PIs or naive sites that are trying to get into industries. How do you make those relationships if no one really wants to talk to you because you don't have all this experience? It's tough.
All right, I'm going to move Irena and Christine up because I don't want their heads to be blocked when I click on comments. You are our guests. Dan Shell says, I know you talked about other organizations that have tried or are working on one of these master feasibility databases. Why haven't these succeeded? It seems CROs and sponsors would find this super efficient and time-saving. Yeah, so Dan, I agree. I think that's why they try to do it, is they're going for super efficient and time-saving. And I don't know if you're as much as of a new guy that we know. You probably you have access to
the new guy for years now. I feel
he's the perma new guy. So I have my thoughts, but I want to hear from Irena and Christine. Like, what do you think about this?
I can go first. We tried using it on the site side. It's not user friendly. It's very complicated to even get in, and usually, it's assigned to an investigator. I have to find time to help my investigators navigate through these systems, right? And it's not user friendly to maybe hopefully help them, guide them to allow me access to kind of answer the questions for the investigators, right? So they have to give me permission. And that takes time. And our investigators are busy. They're still seeing patients in the clinic or in procedures, and they don't have a lot of time. And so when I can find time to help my investigators through these portals, I have maybe 5 minutes, and it better be quick. And so when I get in, there's tons of questions that I have to complete. it's a very time consuming. And so I've completed one just recently, and I would say it took me multiple days to be able to get it completed because I had to chase down my investigators, I had to answer other questions, to not hear anything back from the sponsors if I was selected as a site. So I get that they're trying to have this master database and be more efficient. I don't think, if you talk to the sites, you need to get their feedback. Is it really efficient for the sites to complete these? And a lot of times I would say no.
So what about you, Christine?
Yeah, I don't really know why the databases didn't work out. It seemed, going back to Dan's question, that it seemed that they were, like Irena said, just like clunky and not user friendly, or they were not maybe being kept up to date. But that's all hearsay on my end. I haven't done one of those in a little while. That was from that effort. But I have given a lot of thought recently to what would solve it. And I'm like, who's in the position to solve it? And you're absolutely right. Like, when it's not like it can come from the sites have to push up to too many people, too many organizations, but also it can't come from the sponsor CRO. There's fewer of them, but it still has to be individual then to each group. Now, I will say you can become a preferred partner of a CRO or sponsor, and that'll help you a lot in terms of a master database for that company. But in terms of a true database that covers everything, I don't know. I'm looking like, who actually already holds the data? Maybe IRBs? That's what I've been wondering. Like, somebody actually holds some of this data. I know it's not perfect, but they have like the investigators and, the 1572s hold different information. So I don't know, honestly, Dan, why they failed.
And Christine, to that point with IRBs too, I mean, you submit your annual reviews, your reporting, your what your patient enrollment kind of looks like. So all that kind of stays with your profile, right? I mean,
you would think, yeah. I think that there is a lot of data there.
It's a phenomenal question, Dan. It's a brain teaser for sure. I would agree with the clunkability, if we can make that a word. And I say that as a subject matter expert that consulted for a particular platform that was shared for investigators. And yeah, it was clunky. Part of the problems with some of them were that they were forced tech, and nobody likes being told that you have to use this in order to do business with us. I understand like the time constraints, and that's part of what my job was for a period of time, where Irena was commenting on. It's difficult. You don't have the time to do all this and delegate tasks to everyone and get everyone to delegate their responsibilities to you or these super users, and then managing all the information for the site and every individual user and loading these profiles. It is very time consuming. But I also understand there is an aspect where you have this, well, this is a lot of time, but then the other end of the spectrum, you have the top down that's saying, well, yeah, but if you just dedicate the time and get it done, then you shouldn't have to worry about it again. You're not going to have to continue to do these feasibilities. Like, it's not just a one-time thing. You're going to be in this platform, and then your profile is going to live in here forever, and it's going to save you time down the road.
I would say that at the last company I was with, which was a site network, hundreds probably of hours between all the people were put into filling up those databases, and then I don't really understand why it didn't work out. Like, it kept having to be renewed, or it wasn't held. And I did hear, though, that there is right now, for the past couple of years, a new effort to make that happen. But what I love about our community, and I use that broadly because I know I'm technically no longer part of the site world, is that we're always like, I know a solution is probably coming, but like, what can I do right now to poke that a little bit faster? So I appreciate that it keeps happening.
So and this is me, I'll come from the contract CTA standpoint for a couple of things. So number one, Dan, just like we were talking about when we talked about the siloing of each project, because of the siloing of each project, because people are expected to be paid money to do all of these things Doesn't matter if it's duplicated. That's their job because that's what the contract says. So there's no bleed over. That's number one. So we have forced duplicity based off of an economic business model. Number two, and I'm sure Irena, you kind of touched on this in your interview, but how are these portals organized? How are these sites classified? And the answer is it's by PI. And that is a big mistake. You are basing a business development system off of a regulatory workflow process, and it's never going to work. For any of you who have ever processed a CTA, how does the PI sign at the bottom of a CTA? What does it say? Anyone?
It depends on the site, but my site's just principal investigator because we have stakeholders that are.
But it's essentially, it says read and acknowledged, right?
Yes. Yes.
Every CTA says that. The PI is not a legal signatory or representative for the company. The PI is an employee, sometimes, maybe an owner, but as a PI, they are the regulatory clinical operations leader of a company. That does not mean that you send the PI business development information. It's up to the site to make that determination, even to do the trial. I can't tell you how many times I had to look at a PI who got an opportunity and say, I'm sorry, our organization is not going to do this. So for that reason, and I'll give you an example, big payment processing system, right? Guess what? We got a login. It was for a PI. We did the trial. 3 years later, we got another trial, different sponsor, different PI. We weren't allowed to log in to that system because they're classified by PI. So Dan, to answer your question, from my legal perspective, these databases and feasibilities are never going to work because they don't base it off of the legal entity that they are contacting. They are itemizing it by principal investigator. And for those hospitals and groups like that, it just doesn't work with their model. And it doesn't work with the legal model of the system. So, contractually, the contractual guru over here.
Mitch was talking earlier. I mean, you started to allude, Mitch, to enrollment, right? So, and which was a slightly, it's a related topic. But one of the things that I think we need to do, and this would not be on the site side, would be if the the company that gave out the feasibility questionnaire looked back and did an analysis of their feasibility answers versus what actually happened at the end of the trial, and maybe did those I don't want to say randomly, but they did a selected sample of them to see, like, did their questions actually ask what they needed, what the site needed to know to be successful? Because over the course of the trial, you totally learn what you're going to need to be successful. And so much can change. Like, did their protocol change right away? Or did they ask one question, but really something else was needed? And I think that level of analysis by the sponsor CRO on their own feasibility questionnaires after the fact would actually be a huge asset to the business model.
Yeah, couldn't agree more. I know it was touched on in the podcast as well. Maybe both of you had even mentioned, but I know Irena definitely did, is where we talk about having that lack of data to begin with, or just what you're asking in the feasibility. If you don't have all of the study documents to look through, you don't have your inclusion exclusion, you just have like a paragraph or so synopsis, like, what is your feasibility even based off of? You're just pulling a general, okay, well, here's a therapeutic area. I've got X number of patients in our database and we can hit a certain percentage. We'll ballpark it. But then you get the inclusion exclusion criteria well after feasibility is done and you've been selected. And now you're finally getting a protocol version that's locked down. Mm-hmm. It's like, well, okay, this is going to be a lot more difficult than we thought. And so many sites say that, like, well, this is a lot more challenging than we thought it was going to be.
Yeah. So cardiology in particular, lipidemiology and lipid tests are very commonly not on a summary page, but then when you get the full protocol, they're part of your inclusion exclusion. So now you're like, my feasibility is totally worthless because you didn't give me all of the information when I had to fill it out.
Right. Well, Christine touched too on the her response about we can fill out a feasibility questionnaire form with the protocol summary, but then a protocol amendment comes out when we're ready to go and has different criteria. It's like a completely different protocol that we're looking at. So, that affects the site, especially when they don't have all the information needed to be able to assess, can they operate this trial at their sites, and then all of a sudden shift gear to, well, this is completely different than what we had envisioned. So our enrollments are not going to be met. And that then reflects the site.
I did. So we have another question from Clara. I'd love to cover this real quick. And this might be from your experiences. Going back to diversity, have you ever seen a push from our sponsors to add sub-investigators with diversity to bring in bigger populations?
So for our sites, we do add sub-investigators with diversity, but again, it's we do that, but it's still going out to the communities, right? To engage them and to bring awareness. And so, I have a ton of investigators that are very passionate about that work right now and going out to the communities and putting that work. But I think it's going to take a while before we actually are able to, have those patient populations kind of think, oh, I remember Irena came out, was kind of talking about clinical research, and let me check in to see if there's anything that, that I might qualify for. They're not thinking about that. But the more I show up and the more we show up and kind of talk about it and just communicate with the community, I think over time, right, we hopefully should be able to bring in more of a bigger diverse population.
And Christine, this might be a piggyback to the same question, but I wanted to ask you from your perspective, do you see a trend where our industry is actually collecting demographics on PIs and sub-Is?
I haven't seen it. But I also still wonder if that is the answer. Maybe it's a component of the answer, but most companies or sites right now that I talk to are small to large site networks. So it's more about the central process. I think we're really looking at like fresh sites that would be interesting, or fresh areas or something like that.
Yeah. So I'd be remiss to not jump in on that question. First of all, I wouldn't want a sponsor to ever kind of make that target, right? As part of, if I were to consult and provide services to a sponsor or CRO on their diversity and inclusion plans, I don't think just targeting, there's diverse PIs or diverse sub-Is, so therefore, these two factors don't necessarily equate to the same thing. If you reach out to sites, I think part of that feasibility process, it would be very valuable for sites to have their own diversity and inclusion plans in place, not just coming down from the sponsors on what their goals are. A site should have their own goals in place, and they should know their demographics and the patients that they're able to reach and are reaching, or how they can, maybe better reach the populations that they want to. But that should be more of a factor than, who PI or sub-I is. Oftentimes that might make a big impact on who your patients are, what your database looks like, but it's not the entirety at all. It might be part of it, but definitely not the entirety.
And I did want to touch, so there's one thing, we talked about the 2-question thing, right? And maybe the duplicity of like 90% of the questions being across all of your feasibilities. I love that idea, Christine. If databases could be streamlined to a point where all of the things about a site were in there that don't change all the time, and sites were in control of that platform and they didn't have to depend on reaching out to a third-party vendor to make changes.
Yeah.
I think that would be really, really cool. But going back to, I think, what both of you said, specifically Irena, are feasibilities asking way too many questions that have nothing to do with a trial?
Yes.
And so the question, how do you tease those out? So what needs to be asked on a feasibility?
Go for it, Irena.
I'll go for it. Okay. Really, I mean, what is the experience of the site, the investigator, the patient population? Do you have the patient population? And really, that it should be that simple, right? I mean, how many trials have we been involved in if you really wanted to know what the experience is, but not getting down to what equipment are you using and when was the last time it got calibrated, and you have this patient population, but do you have this group of patients on this certain therapy, and how many is that, and how many do you see in a month? I mean, do we really need all that information, how many patients we see in a month on this certain therapy, or do you just want this patient population? Give us an inclusion and exclusion. We can definitely take a look at that. Can we really meet the enrollment? So the goal should be enrollment for your trial, not really getting down to the nitty gritty. And then now I have to waste time and resources to be able to answer all those questions to be considered.
And I wonder how much of that is a giant data gold mine that's going to be monetized by other people who are expecting sites to do something for free.
Right.
Irena, I 100% agree with you. And I would add like one for oncology, which is what is their standard of care for this disease right now? Because that really matters. Because if the standard of care at my local cancer center does not match what's in the protocol, you're never going to enroll a soul because no doctor is going to put anyone on it. So that would be a specific oncology thing.
Yeah. But
one question that doesn't come up in either of your answers, and one that I think is interesting because I know, so it's, are you interested in performing this trial? Because they think that by submitting the feasibility, you're interested. It's like a job application. But don't you think there would be a lot of really cool information if it's, are you interested in performing this trial? No, and this is why. We don't ever look into the negative results or try to improve ourselves as a result of the negative results of a feasibility.
I could see the value in that, but I would also just be curious who's going to complete a feasibility if they're not interested in the trial at all.
True.
Like, are you just waiting for an offer to come through to be like, nope?
Well, so you don't have to complete it. You just have to answer one question: why?
Yeah.
Or is it, the inclusion is too strict? The logistics, the patient burden is too heavy. That's a huge one. I'm not pulling a liter of blood out of my patients. Forget it. These kinds of things might help CROs and sponsors to develop better protocols. And you don't have to spend an hour on a feasibility to do it.
Yeah.
No, like when you unsubscribe from an email list, it'll ask you reasons why I get too many emails or whatever. And you would just have like 5 things and other if you want to add it. It's a very intriguing idea.
Yeah.
I mean, I've had questions like that, and it's yes, no, or I'm unsure, because I usually put I'm unsure. I don't have all information I need, right? I just don't have a full protocol yet. I don't have a full pharmacy manual. I don't know what's all going to be involved. And so I'm going to mark unsure. But at the same time, is that going to affect me for being considered as a site if I mark unsure? Are they going to go with the sites that will mark yes and know for sure that they will commit to it?
Yep. Yep. And that's happened to me before too. We've done a feasibility, and I think, Christine, you kind of touched on this, but you click one wrong button, you just say no to one answer. You're immediately locked out of the feasibility. You don't have an option to go back and change anything, and you get an auto reject email. Boom, done. So, how truthful and honest can these things really be if it's this kind of a system?
It's so important, and maybe we'll touch on this one other day, but I totally, truly understand why sponsors and CROs cut the number that sites give them, because the end result ends up being fewer than that number, generally speaking, at the feasibility. which is a different time period than what we say at the SIV, right? We just recognize that we have more information at the SIV than we have feasibility. But at feasibility, I do see why they cut it. I just would love for people to start asking, do a root cause analysis, and don't stop asking questions till you get the answer. Like, are sites fibbing on the numbers? I'm going to say mostly no. Like, vast majority of people are not. It's really more not having the information. There's some other issues there, but there's a root cause too of answering the wrong or asking the wrong questions, trying to get the wrong data, and some of the other things that you were just talking about that, I don't know. I think that's it. Like, we have to really look at, like, how are these working out, and truly why are they not working out? And I don't think there's any misgiving. I've never met anyone in clinical research who was trying to do the wrong thing or was trying to lie or anything. And so, believing everyone's trying to do the best, where's this process failing?
Yeah.
So,
I mean, well, it does happen.
Yeah.
I think the majority are in good faith, but obviously we have regulatory bodies in place for that reason. But I mean, you make a really, really valid point. You know, if the feasibilities come back and it's just like, we're expecting to see somewhere like 5 to 10 patients over the course of the next 6 months for this difficult to enroll study. And they're like, oh, we got 250, easy. You know, it's like, well, the whole study is maybe aiming for like 200. You know, so that's pretty wild. But I think that's a good point. You know, oftentimes that those might just be easily discarded, as opposed to let's be a little bit more intentional there and follow up and say, well, where are you getting this from? Just curiosity, you know, entertain me. How are you getting to these numbers? You know, because that might, to your point, help us understand, you know, from that like sponsor CRO side, like, well, what are we doing wrong? Are we asking it the wrong way? Because like any communication, there's how it's sent, how it's received. So it could just be that the communications we're sending out are received horribly wrong.
Well, and there's also the part that Dr. Fox was talking about, right? Like, that's the other part that I was blanking for a second there. Sorry. But it was that, what if truly it's the process? Like, the form, the electronic form is kicking people out for a mistake, which we've all seen with ePros. And now you can't screen your patient because their finger slipped. That's ridiculous, and it's not good for any of us. So, like, can you even go back to the most simple basics of how you complete the form, for example? So many options, I think, for improvement there, just from like a Lean Six Sigma, just blast that thing.
And I have to ask, because this triggered when you said root cause analysis, Christine. But why are sponsors and CROs in such a hurry? Do we know? I mean, I can make assumption. You got patents, time, money, that.
Yeah.
But why are we in such a hurry that we're so wasteful and hasty?
I think you would. I don't want to make it sound like anyone's to blame. I think, though, that just the way business happens, that CROs are usually hired with the idea of this milestone will be met at this time. It'll be
Timelines. Okay.
Yeah. And so for each of those, there's a little bit of an improvement in how their compensation goes. And because of that, there can be, I think, a rush at the beginning to hit all of those milestones, prove your worth, get all the compensation that goes with it. And I'm not boiling it down to that. I think that's a reasonable thing to do. Thank you for asking the question, because I would personally love to see a whole lot more incentive to have the end goal, which is on June 1st, 2026, this trial is fully enrolled, enrollment close date, and 96% usable data. And if I had that, thank you. Like, you are the best. And to the CRO, and do it that way, and not do the upfront milestone payments.
Yeah, so I didn't know if it was incentivized timelines, like timeline bonuses, or if it was skeleton RFPs, or maybe a combination of both. But on top of that, why can't sites be paid in a similar way? Oh yeah, we have regulations around it, anti-kickback. But does that mean the anti-kickback and fair market value doesn't apply to CROs?
Oh, big questions, man.
Sorry.
Well, I mean, you get feasibilities that go straight through sponsors. Even if you have like CROs that are partnered with them, they might be directly embedded with a sponsor. So
yeah,
you don't have that same like RFP that you're going for. You're just part of the sponsor at that point.
Yeah.
So,
well, sponsors, they approve what project budgets, and that's kind of like their RFP system. They have to go through that. But one way or the other, you're making this recommended budget, and it either gets approved or denied by a sponsor or a CRO, whatever it might be. And then you're going through here. So it's strictly a financial timeline incentive in many ways to rush sites into doing something that may not be good quality.
Yeah, I mean, I've long felt that there is a heavy push to add value for shareholders, and it's unfortunate. And I think a lot of times, especially lately in this industry, I've been around since 2005 as well. So especially lately, where I feel like I just see it a lot more. Where instead of going, A, B, C, and let's get our ducks in a row to begin with, so then we maybe are a little bit slower, but the quality is there. Maybe we'd still deliver on time. It's just like, well, what if we can deliver faster? Let's do this as quick as possible. Let's get this done before we even have, all of our inclusion exclusion criteria. We don't have a finalized protocol version. We do have a draft, but let's start scheduling these qualification visits. It's like,
or we can get it through. We'll just do a change order later.
Yeah, exactly.
As long as we can get it through, we'll just do a change order once we have the business. Yeah, that's
this would be a fun, because I don't think any of us have ever worked at a CRO or sponsor. I think it would be a really fun conversation to have one around milestones and timelines that involved some other people who knew that. It certainly does feel rushed on the site side. I will say that. And it also doesn't seem like we have all the information we need. I mean, sometimes even at SIV, and that is going to be a real problem that makes the site look bad. I'm sure you've all been in the place where it's like the CRA has told you, I just got this protocol 2 days ago, and this won't be my trial. And so what do? They read the slides to you, but that means you're not actually learning. So, there could be, and I will say there could be technology that could teach it. Like, could there be some training opportunity online that makes it better, so that, because everyone's having staffing problems. Like, I see everyone's perspective. I just don't know the full milestone thing. I do think it's definitely hurting us, though, when we're not fully prepared.
Well, so that's a huge challenge. It's really hard to get sponsors and CROs to come onto a show because they're so regulated. They have corporate policy. We're not allowed to talk about this. We don't want to compromise our stocks. So that's the hard part, is a lot of these people want to speak up, but they are so barred from doing it that we really have a hard time getting their perspective. Admittedly, we are at our hour, which, what an amazing conversation. We could go for 2 more, but we are going to wrap it up. So importantly, Irena, Christine, and then Mitch, if I gave you the microphone right now and I said, what would you like to tell the entire industry about feasibilities, how you see them now and where you'd like to see them go, what would you tell them?
That was Irena first, right?
Yes.
Me first? Okay. I was like, who's going first? There is a lot of room for improvement. We need to improve on how we're running clinical trials. We're moving too fast. We have to slow down. We need quality data and patient safety, right? But where does that start? And is that feasibility? And so there's a lot of room for improvement. I don't have the solution. I think we just need to continue to have these conversations, but not just having conversations, but coming to the table with ideas and solutions. And then it's not going to be perfect, but how do we improve as we continue to talk about this? And so really make sure to include your sites, not just the investigators, not just the PIs, but include the coordinators in these conversations when we're trying to when you're trying to put a protocol together and you're putting a feasibility questionnaire together, get the sites involved so that, and I get it, every site are operate differently, but get some feedback so that you can help improve and help out the sites. I think the sites at the site level, we really need a lot of support from the sponsors and CROs to help us keep going. participate in these trials. So really, I think I continue to collaborate, and just work on finding some kind of solution.
Perfect. Christine?
Yeah, milestones are a big thing for me. But since we just talked about them, I'll just go out and propose a brand new system or just an added step, which goes to the slowing down. We should have the initial feasibility form, which is kind of how we have it now, but let's improve it. Get the study award. After the study award, another feasibility form I think should be done that asks the more detailed questions and has truly the full protocol. Like if we can't get it with the initial form, then can we get it after the study award? We should not be held to the initial feasibility form after study, before the trial starts. Then we could have a decision by both parties to proceed. So it's a decision to really keep dating, right? They've gone out on the dates. And then you would have the study startup launch. That would be my proposed plan.
Mitch?
Loved it. So I don't know that I want to give people my takeaways as more so challenge people to understand. I mean, I made the analogy to being an online dating app, right? So how do we improve that process? I want to encourage everybody to be more collaborative, be interactive, have a voice. But I also have been seeing this entire time when we talk about like cost and time and everything. It's really what it comes down to is that iron triangle of project management, where you have, the scope of work, the time that's involved, and the cost. And you can't change one of those things without impacting the others. And I'd have to encourage everyone in the industry, and I know sites feel it too, but I'd have to encourage everyone that, you're not necessarily though all the time. You might try to save costs by decreasing the time, but it's not necessarily always the case. If you miss the quality, it's going to ultimately impact and extend that time to study completion. And you're just, every day that study goes longer, we're just burning money from the sponsor side. So getting it done right is probably the most important thing always that we need to focus on, not just how quickly we can get it done.
So I'll do one analogy and I'll wrap it up. But here in my hometown, there is a tire shop. That tire shop has a special community deal. They said, come in and pay us $25 and we'll give you a full-fledged inspection of your car. And then we'll come back to you for your inspection and we'll tell you everything that your car needs. And if you decide that you want to do business at our tire shop, we'll give you your $25 back. That is what they do at a community tire shop. And this is where I'm trying to get to. And I said it on the podcast. The fact that sites are creating databases for CROs for free is a sheer sign that the time of the site is not respected. I truly believe that to really change this, to compensate our sites, to put forth the effort to build a feasibility, I think that it shows that you respect our sites, you value their time, and importantly, you're going to get high quality. And guess what? There is a tire shop analogy in clinical research. There is a sponsor right now that pays sites to do feasibilities. And then if that site is awarded a trial, it is deducted from their CTA. It happens already. And that sponsor is one of the most respected sponsors in this industry. So for that reason, I really do think that compensating our sites appropriately for their time would help tremendously for quality feasibility. We're going to wrap it up. This is Dr. Fox, CRPN Central. If you liked this episode, please raise your hand. Yay.
Both hands.
Thanks. Both hands. Oh,
Creepy
please.
when you do it, Mitch. The back.
Overachiever.
In all sincerity, please consider subscribing to the YouTube channel. It helps this mission more than you know. And importantly, I really appreciate Irena, Christine, Mitch. Thank you so much for coming on Juneteenth to talk about feasibility and diversity. And if you have any questions, please feel free to reach out to any of these superstars. And we'll see you next time. Bye, everyone.
Bye.
Guys, bye.